We will work with fact-based, data-driven approach to reopening our economy in a way that protects families and workers from the spread of COVID-19. When we look at workplace risks, I will be examining factors like whether the workers interact with the public, whether the workplace is indoors or outdoors, whether workers are in close proximity to one another.
Our mission now is to get back to work and get back to work safely at the right time. Not too early, but not too late either. Good morning. My name is Dave Scott. This is the Megacast all across Oakland County. Thank you very much for joining us. We are live on a number of great radio stations, and that includes 89.3 Lakes FM, 88.1 WBFH, The Biff in Bloomfield Hills, WAHS 89.5 Avondale Community Radio, covering just a ton of area, not only in Oakland County, but also all across much of Macomb County. So good to have you with us on the radio. You can also watch us on TV. We are on Civic Center TV, channel 15, channel 99 on AT&T. So the channel 15 signal, just the greater West Bloomfield area. The channel 99, you can get it anywhere across southeastern Michigan. The way I like to watch a show, if I was watching, I can't watch because I'm here, but if I was watching, the way I would watch a show is at civiccentertv.com. That is civiccentertv.com, and we hope you tune in over the next couple of hours as we are going to provide you, hopefully, the most up-to-date and current information about this coronavirus going on right here in our own community. Tyler Keefe is standing by as well. We'll check in with him in our studios. My name is Dave Scott, and we just wiped the whole studio down with our Clorox bleach wipes, which are great for cleaning, terrible for the toilet, but great for cleaning. We hope you keep your place clean, wash your hands, social distancing, stay at home when you can, only go to work if you're an essential worker, and all these things that we've been talking about for several weeks now have really helped out in Michigan. Our headlines today say the University of Michigan has a report that says Oakland County numbers seem to be plateauing, is their word. That's really good news. Governor is an update this afternoon at 3 o'clock. We are going to talk to the Oakland County chief medical person in just a couple of minutes, and he's going to tell us about some really good news and breaking news about testing in Oakland County. That is Dr. Russell Faust. But right now, let's check in via Zoom with our good friend Kurt Lawson from the West Bloomfield Police Department. And Officer Lawson, good morning. Thank you for joining us on the Megacast.
Good morning, Dave. You're looking great today.
Well, thank you. You are too. I got a different view in your office. What are all those plaques on the wall right behind you?
We're changing some things around, Yeah. Just a little different background for you.
All right. Well, I appreciate it. So the big news today, obviously, we are trying to get back to work. So we'll hear from the governor at 3 o'clock to what that looks like here in the state of Michigan. Testing, we've heard over the weekend from all of the national news media. That's the big issue. But we have more testing in Michigan, and that is really good news. And you'll be happy to hear in about 10 minutes that first responders, even if they're asymptomatic, can now get tested. And if you have any symptoms, you don't need an appointment to get tested in Oakland County anymore. That, my friends, is a huge accomplishment. And Kurt Lawson, I can't imagine that isn't going to be that's got to be very helpful.
Well, it's certainly important to us. And as you know, at the beginning of all this, when I wasn't feeling well, it took over a week to get the test results back. So it's nice to hear that we're ramping up testing all over Oakland County. And, that's one of the first steps, I think, that is going to help us get back to some sort of normalcy as we move forward, because we got to have that testing in place. And I can tell you one thing for sure is that I can see all around the community, people are ready for this to be coming to an end. So it's very important over the next month or two that the government, both local, state, and federal, very carefully lays out a plan and how we can get back to work and do so in a safe manner.
From a law enforcement perspective, Officer Lawson, how are things going in West Bloomfield? And I know you're on a conference call with other law enforcement officials across the county. How are we doing countywide and right in West Bloomfield?
From a law enforcement standpoint, we're doing just fine. We have not seen an increase in call numbers over the last month. Actually, we have seen a decrease The only thing, two sections of run volume that we've seen increase have been to our golf courses. And we've also seen an increase for family troubles, but that's just been a slight increase. Nothing that's been overwhelming, certainly to us.
Well, and we've been hearing that from other law enforcement and other reports from law enforcement across our state, across the country. You take people and they spend an awful lot of time at home, and it's unfortunate, but the domestic violence issues, I guess, are not any real surprise, and I know you anticipated that. On the golf courses, people want to get out and golf. It was nice, again, yesterday afternoon. Are people golfing in your area? Are you having to remind people that can't do that right now?
So we are reminding people that here in West Bloomfield that we are telling people that is our interpretation of governor's orders that they cannot go out on a public or private golf course. Now, I did just send out an email to the Attorney General's office about half an hour ago, pleading with them for some clarification, because we've been getting some mixed messages. The governor came out about a week and a half ago and said that, no, you cannot golf on a private golf course, even though you have a membership. The Attorney General's office, we had a spokesperson that kind of muddied those waters last weekend in a Free Press article. And now we're seeing around Michigan, different counties having different rules or in different interpretations. So we need some clarification on that. And I'd like to see some more clarification on the voting rules and some of the other gray areas that we're seeing. So maybe today at 3 o'clock when the governor does her discussion with the media, that she can clarify a few things for us.
Yeah, I would hope that would happen. And certainly it's pretty clear, I think, that she doesn't want people golfing. Maybe it wasn't written correctly. Maybe the AG didn't interpret it. Certainly, a lot of people are wondering. They're kind of scratching their head going, well, what's the difference if I go for a walk or I golf? I get that. And then some communities have said, we're just not going to enforce this. I know some sheriff offices around the state. I assume your position here in West Bloomfield is, and other law enforcement is primarily just reminding people when they see them doing something that you guys understand at this point in time is not allowed, with the understanding that people may not have a clear idea, just like you may not have a clear idea what we're supposed to be doing right now.
Right. We're just doing our best to educate people on the interpretation that we have. Now, certainly we work with our local attorneys here. We work with the Oakland County Prosecutor's Office to make sure that we're interpreting those rules or those executive orders correctly.
Your people are out in the community as much as anyone else. How are they doing? Do you have many people that had to take time off? Have you had anybody that recently that's been testing positive, or how's all that going, Kurt Lawson?
Well, as far as the police department, we've been very healthy, and we have so many different protocols in place that I think that's helped from day one to keep everyone healthy. Overall, the fire department's been very healthy. Their run volume has been significantly increased through this whole crisis, but they've done an outstanding job keeping their team members healthy, using those personal protection equipment that they have. We have a very good supply at this time, and keeping those protocols in place, not only from day one, but as we move forward, is going to keep our people happy and healthy, and be able to help our residents.
All right. Anything else, Kurt Lawson, that might be a benefit to folks tuning in today that we don't know?
Well, certainly I think the next 2 weeks is extremely important. And people, they're ready to get out of their house. They're ready to go for walks and go to the parks and enjoy the nicer weather we're probably going to have over the next 2-3 weeks. But they have to keep that social distancing. They have to keep that hygiene. That is just so important. And if you're out, wear those face coverings, wear those face masks. We really believe that's important, and that's going to get us through the next 2 or 3 weeks, so we can hopefully see the state government, the federal government starting to bring things back so we can get back to work.
I look like John Wayne with my bandana on. You know, it's a good look for me when I go into the store with a bandana. I could have done the mask, but the bandana just makes me feel kind of tough, I always wanted to go into a store with a bandana. So that's my look. But, you do whatever you can do, right, Kurt Lawson?
Absolutely.
All
Keep
right.
yourself safe. You're very important. You're doing a great job, and we
Thank
appreciate
you.
you.
Thank you very much. You too. Appreciate your time this morning. He is Kurt Lawson of the West Bloomfield Police Department, and I know he speaks to the other departments around our area. We're going to take a break. I am so happy today to have an opportunity to chat with certainly somebody who is right on the front line of this whole coronavirus crisis. It is our medical director in the Oakland County Health Department, Dr. Russell Faust. Dr. Russell Faust, and we will talk to him in just a moment after this quick timeout. This is the Megacast.
Hi, I'm Dr. Jonay Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
All right, well, welcome back to the Megacast. If you're watching us on Civic Center TV right now, you can see that I've got my Clorox disinfectant wipes right here in hand. And I don't, Tyler's in the studio. Tyler Keefe is here. I'm not sure who else gets in here at night when I'm not here. No one's supposed to be in the building, but, we got to keep everything clean.
Yeah.
My house, I'm not naturally a really clean person, to be honest, but, I'm a bachelor, right? I'm a bachelor. I live at home alone, and, but my house is so clean right now. What else do? You clean up your house, you wash your hands. I tell you what, Tyler, we have never been so clean. How about you?
Same with me. I other than a nice walk yesterday on the trails here in West Bloomfield, I was just cleaning my place all weekend. So
now, this guy, look at Dr. Russell Faust on Zoom. I mean, you look like you are much better about keeping your hands washed than we radio guys, but thank you very much. The medical director of the Oakland County Health Department joins us via Zoom, and thank you very much for joining us this morning. We're all learning through this process, sir.
Thanks for the invitation to be here. And I just want to give a shout out to Officer Lawson for all our law enforcement is doing, and his encouragement for folks to wear, cloth face coverings when they're out in public, and to maintain this, even though people are fed up and they've got cabin fever and they want to get out and about. I suspect this is going to be our new normal, moving ahead and moving beyond the end of this month and into May and June, et cetera. As the restrictions are loosened up, we are going to need to be vigilant about wearing face coverings and washing our hands and maintaining social distancing practices so we can prevent a second peak of COVID-19 in our communities, and especially in those most vulnerable. I really want to emphasize this before we do anything else, emphasize to our listeners and watchers that we need to keep COVID-19 out of our elderly community, who invariably have many comorbidities, that is, additional issues, health issues that we all accumulate as we mature, let's say, as we age. Cardiovascular disease or chronic lung disease, high blood pressure, things like that make us much more vulnerable.
Well, it's well said, Dr. Faust. I appreciate that message. And, it's on us now, okay? Likely over the next couple of months, things are going to open up a little bit. We've all been at home, and as a community, it's probably a little bit easier, a little bit safer when we're all at home. Now, it's on all of us to pull this off together. Okay, it absolutely is, because now as things open up, maybe we'll hear from the governor this afternoon. I don't know what she's going to talk about, but at some point, phase 1, phase 2, phase 3 of the federal program that you've been hearing the president and others talk about, or whatever she comes up with, whatever it is, it's not going to be what we've been doing. So we really have to step up our game now, and I'm really glad you're on the show with us and taking time to remind people of the things they need to do. I think we've done pretty well. U of M said this morning in an article I read that here in Oakland County, we are seeing a plateau. What are you seeing, sir?
I'm a little ambivalent about announcing something like a plateau. we still have cases increasing. We still have additional cases every day. And it's not clear. There's just no way to be able to accurately say where we are on the clinical curve without readily available testing widespread through our community. And we know we just haven't had that. We haven't had that from the very beginning. That was the major shortage, was the availability of testing for COVID-19. And we continue to have a deficit nationally and locally. I will say this, our fatalities will continue to peak. We have not even come close to the peak of fatalities. And again, disproportionately in our most vulnerable populations, our elderly.
Well, I'm an optimistic by nature, so you have to forgive me. But you're right, and I've seen those numbers too, and it's so disheartening to see that while we are seeing some of the other numbers certainly starting to go in the right direction, and I understand your caution, and I respect that with your comments today, but we're not seeing that on the fatalities, and that's got to be a little frustrating. We're not. It's a bellwether that we're not there yet.
Agreed. Just to give you a sense, as of this morning, we had 6,170 positive confirmed cases in Oakland County. That's out of a total of about 18,000 tests conducted. And that comes up to about a 33% positive rate. Now, that is a little bit of a biased number in that up until recently, most of the hospitals have only been testing those that are the most ill, the most severely symptomatic. So naturally, there would be a fairly high percentage of those folks being positive by testing for COVID-19. I'm optimistic, as you are, as we're adding testing at all our hospitals, as well as some drive-up sites in the county, and through availability of additional testing from commercial or private laboratories. We've just opened up drive-up testing here at Oakland County at our Pontiac campus, near the courts in the Pontiac Oakland County campus. So let me just mention a couple things. We must have an appointment to get a test. There's no same day registration and, drive up. You can't just drive up and expect to be tested. But some great news relative to other sites. You don't need a physician's prescription. You don't need money. This is free of charge. So for the general population, for the general public, they must have symptoms, and that's about it. So we have really lowered the bar for requirements to be tested. And in addition, as of today, I think you mentioned this a couple minutes ago, those in healthcare, those in critical infrastructure, and those first responders don't even need to have symptoms. They just simply call, get an appointment, and get here and get testing. I will tell you this, it might take you a day or two to get in to have an appointment, but our turnaround at the lab is extremely quick. We're talking 24 to 48 hours. So even compared to other sites that can get you in today to be tested, they're not getting their results back for a week. So we can get your results fairly quickly on a relatively basis.
Well, that is great news. Dr. Russell Faust joining us. He's a medical director, Oakland County Health Department. And that is really good news. Good to hear the first responders can get in and test regardless of their situation. They, so many of us asymptomatic, likely, it's good that they can go in and find out because they're right there in the front line and they're very exposed. I thought I saw a report, too, that St. Joe also is going to have some drive-in testing and that people can go there and they have increased capacity for testing in Oakland County as well.
There are several hospitals right now. I believe originally West Bloomfield Henry Ford had opened up a drive-up testing. I'm not sure whether that's still open or not. I know Beaumont Royal Oak has drive-up testing. Of course, there's a state fairgrounds down in Wayne County,
Mm-hmm.
and they have drive-up testing. As you say, I believe St. Joe's is now opening up as well.
Yeah, it's good news. There seems to be
Great
more.
news.
Now, clearly, we had a little debate over the weekend in the media, played out in the media, and what I really appreciate about you coming on and this show is that we're so local. We can find out what's really happening right here to the best of our ability, and it doesn't matter what one person or one pundit says on the national news. So we did hear the president say there's plenty of testing, and then we heard Governor Whitmer say, and I hear you laughing, we'll give you a chance to respond, and then I heard Governor Whitmer say, well, yeah, but we don't have the swabs, and we don't have the other stuff. Now, as I understand it, correct me if I'm wrong, Dr. Faust, a lot of the supplies for Oakland County, they come through your department and then get distributed out. A, is that true? And B, where are we at with supplies here in Oakland County?
Oh, man, that is all over the board. In fact, we are contracting with multiple laboratories. Some of those laboratories, as part of the testing charge, include swabs and viral transport medium and all the necessary reagents to perform the test. Other laboratories will run the test if we get a sample to them, meaning we have to come up with the swab and the viral transport medium and get it to them. And they're all over the board. And at the other end of that spectrum are laboratories that have the PCR machine, and they might have the primers to perform that test. They just can't get their hands on the reagents to perform the PCR or polymerase chain reaction molecular test. And again, Whitmer's absolutely right. There are not enough supplies for us to conduct testing community-wide as we really need to. I mean, this must happen for us to know where we are on the clinical curve. That is, are we still going to peak? How widespread is this in our community to know how and when we can begin to loosen up restrictions to avoid a second peak and major fatalities. We really need to know where we are on the curve. And that's our goal here for setting up testing and lowering the bar to get folks in there and get our community tested.
I appreciate everything you're doing, and good news, especially for our first responders. Good to see that there's more testing. Do you see a day, and I know your job is to not be a pundit and predict, but do you see a day where down the road at some point we might have enough testing where you could literally go to your local corner pharmacy and maybe get a test and see where we're at? Is that a possible interim situation before we have vaccines, before we have other medications that can help cure or help us at least through this virus?
No, I think you're right. I believe I have heard rumors over the weekend of some national chain pharmacies actually beginning to conduct testing. And it wasn't clear to me whether that was the approved molecular testing to diagnose COVID-19 or whether that was the antibody test to look for the buildup of an immune response. And let me just be very clear, those antibody tests are not to diagnose COVID-19. They're really looking for someone's antibody titer. They're looking for whether or not you've been exposed, perhaps been infected, and whether you're mounting an immune response with antibodies.
Are you in touch with the governor's office, and do health departments and directors like yourself, Russell Faust, are you talking with the other departments and talking with the governor? And I mean, you're right in the front line. Oakland County is certainly unfortunately, we are one of the most impacted counties in the nation right here.
We are. So we have the statewide Association of Medical Directors and Preventive Care Physicians, and we're in contact with each other. There must be at least a dozen emails a day and regular phone calls. And we are in direct contact through myself, our director here at Oakland County, Director of Health and Human Services, as well as our health officer. So Director Kathy Forsley, Health Officer Leanne Stafford, with the health officer at state, Jonae Caldoon. So, and I have to say, Dr. Caldoun is really very responsive to the statewide health experts that can consult with her and confer with her regularly.
Well,
I-
Dr. Faust, I appreciate you taking time for us today. We got a great team here. You in Oakland County, Dr. Caldoun in Lansing, and we have to be cautious. But I know you understand that all of us who are living with this in our homes every day, and I'm one of the lucky ones. I'm an essential worker. I get to get out of the house and come to the studio.
Yeah.
But for most of the people tuning in right now, all across Oakland County, they're still in their home. It's really, really tough for them, and we know that you're doing the best to get the right medical answers so we can open this up and do it in a safe way. And I know that's what you're working on. Is that correct?
We are, absolutely. I think ramping up testing as aggressively as we can right now is going to give us a better sense of how pervasive this is in our community. And we're trying to add antibody testing to get a sense of how many have recovered from a COVID-19 infection and really get the data. We have to know where we are in the clinical curve to know what to expect on the far side of that curve. Let me just give you the optimistic view right now. Fortunately, right now, as we head toward loosening restrictions, and I can't predict when that will be, but as we head in that direction, note that we now have PPE. We have the things in place that we didn't have 2 months ago when we entered this crisis. We now have personal protective equipment. We have masks, we have gowns, we have gloves, we have face shields. We get in more all the time. We have manufacturers, local and regional, ramping up production of these absolutely essential protective equipment for our front line and our healthcare providers. So that's a huge positive. We have testing coming online now. Certainly there will be some level of immunity in our community now, as we'll have some uncertain number of people who have been infected with COVID-19, have recovered now, and they likely will not become reinfected. So we have that as an advantage and our benefit as we head past this curve. I think we're ready now. We have more than 100 people now trained in Oakland County Health Division to perform contact investigations and trace investigations, things that we just didn't have 2 months ago, and ramp that up. So I think we're in a much better position now to prevent a second peak, a huge number of fatalities, and to, quote, flatten the curve. I think we're in a much better position.
All right. Well, Dr. Faust, that'll happen because of a lot of good work and a lot of cooperation. Is that happening with CDC people that are here in Michigan, or are we doing that ourselves locally with local county health departments and state people and local physicians, or how is that working?
Yeah, we do that locally. As I say, we've trained over 100 people here to perform those contact investigations. And a lot of it's coordinated with state. That is, regardless of where someone tests positive, wherever that positive test result comes up, it's communicated to state, it's entered into the state database, that's communicated back to us. That happens fairly rapidly, and we coordinate with them. Originally, it was a direct phone call. Mm-hmm. Now it's automated, and we begin to conduct that investigation.
Dr. Faust, you've been so generous with your time. One final question. I'm thinking that, we have enormous challenges here in Oakland County, but we also have a lot of resources. And as a lot of us get ready to head up north, hopefully, for at least some point during the summer and go to less populous counties, is it possible that those counties are not as equipped as you are in Oakland County to deal with some of this?
That's a great point, and thank you for asking. They are absolutely not as well equipped. We have hospitals here in Oakland County that are part of large systems, even multi-state systems, and they've had the resources, frankly, to be able to recruit resources, that is equipment such as ventilators, to redeploy staff such as nurses and emergency physicians and hospitalists, to bring them in from their distant hospitals in less populated settings in order to in order to manage through this crisis here. So I think for those folks, those systems, they'll be able to redeploy to the less populated and less prepared communities. I'm worried about those communities that have a standalone hospital that are not part of a large system. And I think based on what I've seen so far, I think these hospitals and systems are going to be team players and be generous with regard to redeploying things like ventilators and staff. So I think they'll be okay, but that is certainly a concern. I'm worried about those little towns.
All right. Well, hopefully we will all work together to get through this, and hopefully as we come out of this, we do it in a smart way. And you're doing everything you can. Great job. I know they're doing the best they can in Lansing as well, and now we're just going to work real hard, do our job to make sure that all the folks that are tuning in and everyone they know is washing their hands and taking care of themselves and putting those bandanas or face masks on or do whatever they need to do. I also pulled, I want to make sure I get this right, I did pull the number for the hotline to call if you want to get tested in Oakland County. And if my information is correct, that number is 248-848-5533. 248-848-5533. That'll get you to the nurse on-call hotline. And again, Dr. Faust,
let's make that the 800 number.
Okay.
Let's make it 800-848-5533.
Even better yet, toll free, the whole thing, and it's free. You get tested in Oakland County at the county building. You don't have to pay a penny. Is that correct, sir?
That's absolutely correct.
All right. So call that number.
No copay, no nothing.
Call that number. They'll get you in. You just got to say that you're not feeling well, and you'll probably get a test, right?
Yes.
All right. Thank you very much. Been charitable with your time.
You.
We appreciate it. Let's keep in touch.
Thank you.
He is Dr. Russell Faust, Medical Director, Oakland County Health Department. I feel better, Tyler, just after talking to him.
Yeah.
He seems to be on the ball, and we have these doctors that we've been meeting through the media. There's so many of them are so amazing. They don't, they're the rock stars of the coronavirus crisis here, and we're getting to know them. And it's really amazing. Some of these people that have all this knowledge and all this skill, and they're saving our lives every day. So they're greatly appreciated. We're going to take a quick break. We'll be right back, and we'll have more. Coming up in just a minute, we're going to talk to the president and founder of the Pontiac Community Foundation. Dustin McClellan will join us, and we'll find out what they're up to and their part in keeping us all alive and healthy and well. We'll be right back. Dave Scott of the Megacast along with Tyler Keefe, and you don't go away.
Coronavirus is deadly, but Michigan can fight back. Our front doors are the front lines of defense. Staying home is the best way to stop the spread, because just one infected person can give it to 40, who can give it to countless more. So call Grandma, don't visit, video chat, don't meet up. And if you must go out for food or medicine, keep at least 6 feet from others. Stay home, stay safe, stop the spread.
Well said. Thank you very much for joining us and staying home, staying safe, and stopping the spread wherever you are. Thank you for joining. You can spread one thing. Don't spread the coronavirus. Wash your hands. But you can spread the news about the Megacast. That's okay. That can travel across Oakland County like a virus. Is that an inappropriate comment? Probably not the best way. Okay. Well, you know what I'm trying. You know what I'm trying to say. So tune in. 89.3 Lakes FM, 88.1 WBFH The Biff, WAHS 89.5 Avondale Community Radio, Civic Center TV, Channel 15 in the West Bloomfield area, Channel 99 across all of southeastern Michigan on AT&T if you're a subscriber there. And today, who is our Facebook partner today?
Today, our Facebook partner is the West Bloomfield Police Department.
All right, so you can go to Facebook Live in the West Bloomfield Police Department Facebook page, and you can watch the show there as well. Thank you very, very much for being a part of it. You're doing a good job by keeping yourself informed and being a part of the broadcast. Talk about people doing a good job. This guy is the president and founder of the Pontiac Community Foundation. Dustin McClellan joins us right now via Zoom. Hey, Dustin, how you doing today?
There, Dave. I'm doing well. How about yourself?
I'm doing pretty good. We're the lucky ones. So many people have
That's
suffered.
right.
I joke around because I'm trying to get through this the best way I can. But, hey, I recognize there are people suffering right now. There are people suffering. All the reports that we've seen, Dustin, you've probably seen them as well, that this disease is brutal. I mean, you get this thing and you get it in a bad way. It can obviously kill you, as it has way too many people, and it can mess you up for a while. So we're doing everything we can to keep people from running into that circumstance. And
That's right.
so I feel fortunate that I'm okay today. And you look like you're doing
Absolutely.
pretty fine too.
Doing well, healthy here. Absolutely.
Tell me about the Pontiac Community Foundation, what you folks do.
Absolutely. Well, I appreciate you taking the time to have us on. The Pontiac Community Foundation is a 501c3 in the city of Pontiac that is dedicated to building a brighter future for Pontiac. We engage philanthropy, leadership, and collaboration to tackle Pontiac's most pressing issues. And we really feel like education, leadership development, and quality of life initiatives need intense focus in a city like Pontiac. And so over the last 2 years, we've been raising funds and starting initiatives and programs to move the needle on those items. And when the COVID-19 crisis came to our doorstep, we felt that like we needed to get into action at an even greater level.
Well, the need is there, and none of us saw this coming. I mean, none of us saw this coming, but it's here. It's on our doorstep, and there's some really, really capable people in our community. I'm sure you heard from Dr. Faust there as you were getting
Absolutely.
set up and hooked up, and what he's clearly doing a great job. We got first responders and the bravest nurses and doctors, but it takes more. And we really, especially here in Oakland County, and especially in Wayne County, we've realized that we have our minority communities in these areas are just this thing is hitting them really hard. It's hitting the African American community and the other communities harder than any other community, and help is needed. So where do we start? What are you working on?
Yeah, so when we, all of what you said is right. And when we had this crisis come to our doorstep, really when the governor shut the school system down the first time is when we realized that our students, our families, our people here in the city would need some additional help. So the first thing we did is we got all of our community partners together, our religious leaders, our governmental officials, our nonprofits and agencies, and just begin to talk, have a conversation about what we felt would be needed in our community, what resources we had to help. And the city of Pontiac quickly pointed to us and said, okay, the Community Foundation is going to lead this effort and kind of convene and collaborate with everyone to get it done. So the first major need we identified was food. Access to quality, affordable food is tough for Pontiac folks under normal circumstances in a city that some would deem as underserved, a city where 50% of the children live in poverty on a regular basis. Making sure folks had food as their income streams are dried up was going to be critical. So we started with getting distribution sites online. Additionally, making sure our food banks and food pantries had additional resources and food. That was the critical aspect. We also realized there would be other issues, things like virtual tutoring for kids in the Pontiac School District, infant care products, household goods, grief and prayer support. Even now, we're starting to get into a burial fund for those that have lost loved ones in the city. And so we corralled all of those needs and partnered with a web developer, a good friend of mine that started the website mycovidresponse.org. And what he saw was that individuals were out on Facebook and on socials saying, hey, if you need anything, I'll run to the store and get it for you and drop it on your doorstep. And he said, what if we were able to kind of convene all those people together and to have a coordinated effort of meeting the needs in the community? And so that's where the website came from. And so on the front end, folks in the community, it started with Pontiac predominantly, and now it's expanded to all of Oakland County, can go on the website, list their information, indicate their need. That need comes into our system, and on the back end, we've got case managers that take a look at that need and partner that family with a volunteer that can help meet that need. They may be meeting it virtually by way of tutoring and a phone call or brief support if they're qualified to do that. But a lot of the volunteers that are healthy and able are able to pick up a care package from our distribution center at Oakland University and drop that right on the doorstep of those in need. And we've seen literally hundreds. There's almost 1,000 people in our database right now, 1,000 families in our database right now, and well over 750 volunteers that are helping to make this effort possible.
Well, Dustin, I love that. See, now we're getting right back down to people just coming together and helping their neighbor through a crisis. So we did hear on Friday about Oakland University and what's going on over there and how it's become a distribution point for goods, but then getting things out to people. That's where you're helping out. And if you're getting a little cabin crazy, you've been spending a little bit too much time at home, you want to do something good, this is a good way to get out of the house if you're healthy.
Absolutely.
And able to deliver some goods to people that wouldn't get it otherwise. I love it. Great idea. Do you still need volunteers and people to help you?
We definitely still need volunteers. Our effort is expanding now. We've actually secured some additional space at Oakland University to expand the effort. And we know that as this crisis continues, even beyond some of the restrictions, we estimate perhaps at least the next 6 weeks, people are going to need help, possibly longer. And so that means we're going to need additional help and volunteers. And folks can go right to the website, mycovidresponse.org, and they can sign up to volunteer.
Do you have any sense? I know it's kind of totally off our agenda. I don't know if you have any idea, but do you have any sense of whether people have transportation problems too in Pontiac? We just had the Oakland County Health Department medical director on. They've got testing over there at the county offices, but I wonder, can people get to them? Are people getting around the community, or is that a problem too?
Yeah, transportation has been an issue in Pontiac for a long time, and in a city where I think the numbers are 2 or 3%, 2% in Oakland County, 3% in the state of Michigan are without a vehicle. I think it's upwards of 10% of people in Pontiac are without a vehicle, and so we're grateful that the Oakland County Executive's Office has brought online a testing site right in Pontiac at the county headquarters, and so that helps. But in the days ahead, we're beginning to talk about how do we safely get Pontiac folks to testing and/or bring more testing sites to the city, because we know that robust testing is one of the few ways that we're going to be able to get through this crisis.
No question about it. Dustin McClellan, president and founder of the Pontiac Community Foundation, joining us today in the broadcast, doing a great job always, but during this crisis, now helping even more by helping to get supplies to people that really need it, and just taking care, keeping an eye on so many other things in Pontiac. Thank you for joining us. Is there anything else you'd like to share with folks that are listening, or any other help that people can provide?
No, I would just say, look out for those around you, and give a phone call to the elderly, look out for your neighbors, make sure everybody's taken care of during this crisis, and I think we'll get through it together. I appreciate you highlighting our work and having me on today.
No problem. Let's keep in touch. Anything we can do, let us know. And Dustin, I look forward to meeting you after this whole thing is over, and we can do it, and maybe not even do it virtually. Maybe we'll be able to get together in person like we used to. So thank you.
Normal, absolutely.
Thank you for being with us today. I appreciate it. Dustin McClellan of the Pontiac Community Foundation. Tyler, just one of so many organizations in our area making a difference. Those are the stories, they don't make big headlines. People don't always report all that stuff, but that's the kind of stuff that makes it feel good, and it helps us through it. And I know there's a lot of need and a lot of people that want to help too.
It is. It's another heartwarming story of people being willing to help their neighbors out, people that they live near, maybe don't live in the same city or the same community as, but people that are in need. And that's one thing that our society really needs at this point in time, is people to step up and say, okay, I can provide some help here, I can provide some help there, and then take action, because that's how the people that are in underserved communities, like places in Pontiac, are going to be able to get through this as well.
Well, we are going to take a quick break. We have a number of really interesting experts coming up in the next hour, so stick around. We're going to talk to Amy Drumm. She is a Vice President of Government Affairs for the Michigan Retailers Association. Talk about a group of people that's really having a difficult time. Not only are many retail outlets closed down, they were already suffering before coronavirus even started from online sales, and brick and mortar retailers having a tough time anyway in our economy. And then this, what's going on in the retail industry? How have they been affected? What does their future look like? We'll talk to them. James Reed is an attorney with Dinsmore and Scholl, and he's an HR specialist, and really has a lot of insight for us and things that might be helpful to you as you've got employees working at home. If you are an employee working at home, what happens when you go back to work? What about all the employment issues as it relates to unemployment benefits and all that? We'll talk to James Reed. And then Dr. Ronald Lederman will join us, an osteopathic surgeon and a sports medicine director. Hopefully when we get back to the new normal, some of the other procedures that you might be waiting for, like my knee is just killing me right now, Tyler, and no big deal, I'll get through it, but at some point I'd like to get back to my doctor and find out why it hurts so bad, right?
Yeah, it'll be interesting to know how we can get back to there's these little ailments that pop up that you kind of just got to tough out during this, and what we can do maybe in the meantime to alleviate those or to get some sort of treatment for those.
All right, so we'll get to that and a whole lot more. We're going to check our headlines. We're going to talk about the Carryout Club and much more when we return. I'm Dave Scott, Tyler Keefe over on the other side of the studio. We thank you for tuning in to Civic Center TV, Channel 15 on Comcast and Channel 99 on AT&T. Also at civiccentertv.com. You can check us out online, and then our incredible radio stations taking the message of this coronavirus crisis to you across Oakland County. 89.3 Lakes FM in West Bloomfield and heading out toward the west. 88.1 WBFH in Bloomfield Hills and heading out to the north, and WAHS 89.5 in Avondale Community Radio. They're transmitted right there at I-75 and M59, and they cover just a bunch of Macomb County and a bunch of Oakland County, so we appreciate our radio stations so much. We're going to take a quick break, and we'll be back with our coronavirus headlines in just a moment.
Hi, I'm Dr. Jonay Khaldun. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
I know you're concerned about the coronavirus, and we're working hard to combat its spread and keep your family safe. But we need your help too. Wash your hands often with soap for at least 20 seconds. Avoid touching your face and cough into your sleeve. Replace handshakes with an elbow bump. Avoid large crowds or events, and if you're sick, stay home and call your health provider. Every one of us can make a difference limiting the virus's spread and keeping Michigan healthy.
I didn't do it right, Tyler. I hope you weren't watching on TV. Did they see that?
Oh, probably.
It's hard to remember to cough into your elbow like that. All right, well, we're all doing what we can. We're doing the best we can. Dave Scott, Tyler Keefe, this is the Megacast. It's not a radio broadcast, not even a television broadcast, not a podcast. It is a Megacast with radio, TV, streaming, Zoom. We're doing Facebook Live on the West Bloomfield Police Department, all in an effort to reach you today. We thank you very much for tuning in. Tyler, it's been amazing, just amazing. I mean, we appreciate people that tune in to our municipal meetings here on Civic Center TV and our other community outlets, and people that tune into community and high school radio stations. But you know what? More people. I've been looking at the metrics of this show, and there are thousands of people that are tuning in every day, and we appreciate it, and hopefully the information we're providing to you is helpful. Governor's going to be talking this afternoon at 3 o'clock, and likely more information. Federal government has laid out 3 steps states can deploy to get us back to work. But it's up to the governors and the states how and when to deploy them. The federal government's providing recommendations, and the federal government says, well, the testing is there. Governor Whitmer on national, by the way, she is all over the national media.
She is.
Everywhere, MSNBC, she was on Meet the Press over the weekend, and certainly her status as a potential running mate for Joe Biden has elevated her visibility. But, you know, Michigan is a key state on the national level, and that's part of the reason she's out there. And also, I think a lot of people think she's doing a good job running the state. I'm sure there's some other people that don't. Yeah. Either way, it's certainly elevating her awareness around the country. And she's got another press conference today at 3 o'clock. I give her a lot of credit for being extremely visible, doing these press conferences virtually every day. On Friday, before the weekend, she spoke to the state of Michigan, and here's what she said about coming out of this thing.
We will work with fact-based, data-driven approach to reopening our economy in a way that protects families and workers from the spread of COVID-19. We will closely examine 4 factors in addition to others that we will be developing, but there are 4 that every one of us governors has acknowledged really important to safely re-engaging sectors of our economy. One is the sustained control of the rate of new infections and hospitalizations. 2, the enhanced ability to test for COVID-19 and to trace. 3, sufficient healthcare capacity and so that we can handle resurgence. That means knowing that our hospitals are not in surge mode, but they are capable of taking care of anyone who needs assistance at the hospital, and they have the PPE to do so safely. And 4th, observing best practices when it comes to social distancing and mitigating the spread of COVID-19. Now, this doesn't mean that our economy is going to open all at once. It doesn't mean that these states are all going to take the exact same steps at the exact same time. But what this does mean is that we are all now working together to make sure that we are making data-driven decisions and protecting people in our region so that we don't see a second wave of COVID-19.
So there's the governor talking on Friday. She'll be talking again today with an update on where we are. And those are all the steps we've heard that must be in place. It was great to hear just moments ago from Dr. Russell Faust, the medical director of the Oakland County Health Department, saying that we're, being optimistic. He wouldn't make any commitment about any predictions, but being optimistic. He said a lot of things are in place. We're getting better with testing, the PPEs and the supplies. We're doing a lot better with that. So, we have made progress over the past several weeks here, and we are in a better place. How far along? Well, I'm sure we'll hear from the governor this afternoon and how ready she might be to relax some of the rules that we currently have in the state.
Yeah, credit to the medical community and to the government for stepping up and getting what needed to be out there for the medical community to treat this and get some time behind. So we had some numbers and some statistics to go over and kind of know where we're at. And now it looks like, from an optimist's point of view, it looks like the impetus is going to shift a little bit more to us civilians to continue to follow those social and physical distancing requirements, washing your hands, keeping your areas and your surfaces clean, so that we can get back to some semblance of normalcy.
Yeah, well, it's been on us the whole way, and it's going to be on us again. Good leadership, a lot of work going on, but bottom line, if we screw this up, we're going to be right back where we are, locked in our houses. So you can open things up, but you got to keep and especially we go back to work. Right, we start going back to work, and we're bringing the coronavirus into the office. We're exposing other people. We're not washing our hands. We're not doing the things that we should be doing. Then we're in trouble. Now, for the most part, I don't know, Tyler. I don't know about you, unless I'm totally asymptomatic. I've been able to go through, coming in here, going to the grocery store, going to the gas station and, following the instructions with my bandana and an awful lot of, washing of the hands. At least I've been able to stay healthy. Not everybody has escaped it, but these are the things that we need to continue to work on. Now, the University of Michigan, if you're on our website, go to civiccentertv.com coronavirus, and you will see the University of Michigan says that, at least they asked a question, our case is peaking. We asked Dr. Faust that question a moment ago from Oakland County. He wouldn't sign on for that yet. He's took a very realistic approach, but here's what an article on our website today says: cautious optimism is in the air for Michiganders. We saw rapid spikes at the end of March and the beginning of April. However, now the numbers seem to be plateauing at a slow rate. Oakland County saw the highest reported cases on April 6th and the most deaths reported in one day on April 10th. But if you go and look at the numbers, they do seem to be slowly getting a little bit better. More information right there on the Civic Center TV website. Michigan Unemployment Agency, more than 1 million Michiganders. Wow, that's a big number. What other 10 million people in Michigan? I think so. Yeah,
right around that.
10 million people in Michigan. Now we find out that more than 1 million Michiganders have applied for benefits through the Michigan Unemployment Insurance Agency. And while most of the technical issues have been fixed on the website, the requests are still very high. It could take you time to get through there. There's a Q&A document linked on our website. If you're having trouble filing for unemployment still and you can't get through, read the Q&A document. Link is right there on our coronavirus page. Scroll down, look for the link that says Unemployment Agency, and click on it, and hopefully more information that will be helpful for you. We were talking about vents, right? Here's a story that says we need more dialysis trouble today. Dialysis machines also, in addition to vents. Medical reports are showing an increase in kidney damage from people suffering from COVID-19. Maybe it's related. I don't know. I'm just reading the report. According to the WAPO, that must be the Washington Post. Okay. About half of the people hospitalized with coronavirus are showing problems in their urine, indicating damage to their kidneys. So maybe some relation. Maybe those are people that already have immune issues already, and maybe that's it might be why they are suffering from the coronavirus. Who knows? Read the article. More information for you. Also, St. Joseph Mercy Hospital is offering 24/7 COVID-19 screening in Pontiac. So this is a story in the Oakland Press. This is important, and I got into this a little bit with Dr. Faust, but this is information from, I got to go subscribe here. We'll do that later. If you're on the website, go to the Oakland Press, and you can find information that says St. Joe Mercy Oakland Hospital is offering 24/7 COVID screening in Pontiac. So you add that hospital to West Bloomfield Henry Ford Hospital and other facilities. Seems like there's more testing around the area, Tyler.
It does, and that's as Dr. Faust said, going to be critically important as we move toward the potential reopening, gradual reopening of society. The more testing we have, the better knowledge we have of where we're at and where we need to be going in fighting COVID-19.
And then the big news this morning from Dr. Faust, he says asymptomatic testing for Oakland County first responders is now available. So if you're a first responder in Oakland County and you are asymptomatic, you can get tested. Kurt Lawson was on earlier, told his story about a week or two ago, and he couldn't get tested, and he's a West Bloomfield police officer, could not get tested initially because he was asymptomatic and just had to go home and quarantine. So then he finally got a test, and it took a while. And how about that other really good news? I think we should put this on our headlines, that Dr. Faust said today that if you are going to get tested in Oakland County, that you're going to get the results back in a day or two. And I heard reports it was taking, maybe a week or two for some people to get their test results back. It's great news.
It is, because the quicker you get the results back, the quicker you can seek treatment. And every second counts in fighting COVID-19 for these patients. So the quick and expedient test results are huge.
Okay, so that's what's happening in the front line here in Oakland County today. In a couple of minutes, we're going to talk to Amy Drumm, Vice President of Government Affairs of the Michigan Retailers. She'll check in. James Reed, an attorney who specializes in human resource issues, will join us, and Dr. Ronald Lederman, osteopathic surgeon and sports medicine doctor. What about all these other procedures that we need to get done and have not been able to get done? What's the status of that? We'll hear from him coming up in just a minute. You are watching Civic Center TV, Channel 15, Comcast, Channel 99, AT&T. You're listening on the radio to three great radio stations: 89.3 WBLD, Orchard Lake, West Bloomfield, Keego Harbor, Sylvan Lake, 88.1 WBFH, Bloomfield Hills, WBFH, the Biff, and WAHS, Auburn Hills, 89.5, Avondale Community Radio. We'll all be back in just a moment.
Hello, I'm Dr. Faust, Medical Director for the Oakland County Health Division. Coronavirus disease 2019, or COVID-19, is a new disease caused by a new respiratory virus named SARS-CoV-2. COVID-19 was first identified in December 2019. There is currently no vaccine to prevent coronavirus disease 2019. The best way to prevent illness is to avoid being exposed to this virus. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Avoid close contact with people who are sick, and avoid touching your eyes, your nose, your mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Finally, stay home when you're sick. For more information about coronavirus disease 2019, go to oakgov.com/health or call 1-800-848-5533.
All right, thank you, Doctor. Thanks for being on the show again today. We really appreciate it. Good morning. This is the Megacast. I'm Dave Scott. He's Tyler Keefe over there. And that on your screen, not that. She is Amy Drumm, Vice President of Government Affairs of the Michigan Retailers. Amy, thank you so much for joining us via Zoom today on the Megacast. Good to have you with us.
Thanks for having me, Dave.
Where are you? You look like you got a plant there. You got a home office, Amy, or where are you?
Yep, I'm at home in my office here.
All right, well, that's nice. How's it? I like to ask this of everybody before I get going. How's it going? I mean, is it tough being at home and dealing with everything that you've had to deal with? How's it going there?
You know, I'm a bit of an introvert, so I don't mind being at home. I will say this is maybe a little bit more alone time than I bargained for, but I can do my job from home. I can talk to folks and answer emails, and it hasn't been a challenge on the work front, just maybe a little bit on the personal front of the weekends are a little bit lonely. But
they do. Yeah, they do. The weekends and the evenings, I find, do get a little lonely because I'm not an introvert, but I spend a lot of time alone, and you know, it's okay. I always have, and I'm just fine with it. But it does get a little bit difficult on the weekends and in the evening. Normally, I might go out and have dinner with friends, and we're not doing that. So I understand, and I know you're working awful hard because the retailers in Michigan have their hands full during this coronavirus. Amy is a vice president of government affairs for the Michigan Retailers Association. And, you guys already have a little bit of struggle dealing with the online merchants. And now I'm sure many of your merchants are brick and mortar merchants, now even worse with the coronavirus. I was going to ask how you're all hanging in there, but I know it's a tough time for retailers in Michigan.
It's definitely a tough time for retailers. And as you mentioned, a lot of sales have moved online, particularly when we've started restricting what types of items you can buy, even in the stores that are allowed to stay open. So we have kind of that double-edged sword of we've got a lot of retailers that are forced to be closed right now. They're not allowed to do curbside or limited contact deliveries, which we think they can do safely. And then you have a lot of retailers that are open that have been restricted in what they can and cannot offer for sale, and have put a lot of restrictions in place that they have to follow in terms of capacity and cleaning and, again, restricting which products can and cannot be considered essential. So it's definitely been a challenging time to be a retailer.
I imagine you're looking forward to hearing what the governor has to say this afternoon at 3 o'clock and hoping that you're going to get some good news and relief for you. And you're right. You know, whether you agree or disagree with the governor, the last set of rules have been very difficult to follow, at the very least, and problematic for a lot of people at the most. And so are you hoping, do you have any insight as to what the governor might say this afternoon at 3 o'clock? And are you looking for some of this to be relaxed a little bit?
Certainly. So I'm a frequent listener to the governor's press conferences every week when they happen. And we keep hoping for more and more relief. We've had a lot of good conversations with the administration and with legislators about what we hope to see happen and what we believe can be done safely. And so we are hoping for good news today, more on the front of what reopening looks like and what triggers we need to hit. And I think the news in terms of the number of cases decreasing over the weekend has been a good positive sign that hopefully we're on the right track to hit that May 1 deadline and start relaxing some of the restrictions we currently have in place.
So you're the VP of Government Affairs for the Michigan retailers. That means you get to head over to the Capitol and talk to lawmakers and lobby on behalf of your organization and do all you can to move your issues forward. What would the Michigan Retailers Association like to see the governor do now?
So we're putting a plan in place of what we think reopening safely can look like that we're going to share with the governor's office and with legislators hopefully tomorrow. But really, it's kind of a phased-in approach of what we can do safely to be realistic. So like I mentioned, we believe that retailers can safely do curbside pickup and home deliveries and obviously online orders with little to no interaction with consumers to keep everybody safe. We believe that can happen right now. We hope that will be the first relaxation of rules to allow for all of that across the board, no matter what you're selling and what type or size of retailer you are. And then, going further, what does it look like to reopen stores and have customers come into the stores? So looking at things realistically, like limiting the number of people who are coming into the stores like we're seeing right now, but doing that across the board for all retail. And when we look at things like that, we want to make sure that those are realistic, that we can have expectations for retailers that they can meet while still operating safely. And we've offered a lot of guidance there, and we're hopeful that we can be a close part of the process going forward to help the administration come up with those guidelines.
So you're seeing what's going on with the restaurants. So the restaurants have been allowed, we got to eat, right? So the restaurants have been allowed to stay in business, and a lot of them are doing curbside. I assume you've watched that, and do you like that? And you feel that you can apply that to a shoe store or getting a laptop, computer, or whatever else? What other merchandise you might need to buy in Michigan? Is that correct?
Absolutely. That's a perfect example, and it's one that we've used often. We believe that if the restaurants have figured out how to do this safely, and they've set up tables right inside the door, or they've allowed for just delivery straight to the car, we believe we can have retailers do the same thing and put those same safeguards in place. So it's a perfect example of something that's working right now that we can apply across the board to more businesses.
Well, the timing, I think, is good if you are able to persuade our lawmakers and the governor to adjust to a program that you would like a little bit better, because at least some of the retailers in Michigan have been able to get loans from the SBA and from other organizations. I know not everyone. A lot of people have had trouble getting it. We've read the accounts, but at least some are able to get that, and that gives them 4-8 weeks of additional time, maybe up to 10 weeks of additional time for having their employees in, and some of those people are getting those loans now and have the resources to keep their staff there. But if you have the SBA loan and your employees are back at work and you can't open your door, what are you to do, right?
Yeah, that's the challenge that we're seeing across the board. And we're also seeing a real challenge with some people still being afraid to come to work and some people that would rather stay on unemployment benefits. The unemployment benefits have been so generous with the federal extension of the $600 extra a week that there are some folks who are really concerned about coming back and what that looks like from a retail standpoint of how do we entice people to come back to work and do their job when they may have more generous benefits on the other side. So we're having that conversation with the administration as well. But to your point, I think there are limited things that retailers can do. They can focus on setting up, online stores to an effect, having that new process in place for when they can reopen, of getting stocked up with, maybe face coverings or sanitizing efforts. Those sorts of things are going to be really critical, so that the easier and quicker they can prepare to be ready to be open, I think the more quickly we can get down that road to have them actually reopen the doors.
How are the retailers doing? Are they optimistic? Are they hanging in there? Are they frustrated? I know you can't represent the feelings of every one of your members, but any wide characterization of how the retailers are doing right now?
I think everything you said, they're feeling all of those feelings just like we all are. It's a lot to take in right now. It's a lot of frustration. It's a lot of fear of what happens if this order to stay home and not be able to do any business continues for several more weeks or more months even. And so we're really looking at how can we help them get through this tough time, have that hope that they're hanging on to, knowing that they can hopefully get some of these loans that are available and, keep their doors open to the extent that when we can physically reopen those doors, they will be able to be ready.
Do you have any sense of? We're going to lose some people. Let's be honest. We're going to lose some businesses here in Michigan. Do you have any sense of what that impact might look like with retailers in Michigan?
I heard all kinds of different numbers on that, and I think we're all guessing at this point. I'm not an economist, so I can't throw out a hard number of what we expect, but like you said, we definitely will be losing some small businesses. And small businesses and small retailers drive the economy, and they have far-reaching impacts just beyond their employees and their store and their community. It's, sales tax dollars that go to fund our schools and income tax dollars that fund the general fund budget for the state. And so we've got a lot of things to think about when we're talking about reopening, and reopening hopefully quickly, at least to some capacity. It's definitely a challenge of how do we go forward and balance safety and public health with the economic concerns of how many businesses will we really lose. And I don't want to put a percentage number on that, because I'm hoping that the more quickly we can reopen, the smaller that number will be.
Well, Amy, thank you very much for joining us. Amy Drumm, she is a Vice President of Government Affairs for the Michigan retailers. We really appreciate you joining us, and I appreciate your thoughts. And we try to do a very objective, nonpartisan, let's hear from everybody kind of broadcast here. And, we certainly, this is a tough debate. This is because we have our health officials very concerned. They don't want to see us get back to from whence we came. And, you've got all of our elected officials are trying to do the right thing. And then there are us business people out here who are getting slaughtered right now. Let's just be honest. This is devastating. This is almost as devastating to businesses as the coronavirus is to our health, and some would say equally. So, our thoughts are with you and all of our Michigan retailers, and I cannot wait for this thing to get under control and take my credit card and go spend an awful lot of money and help out all the Michigan retailers as soon as we can. So best wishes to you. Anything else you want to add to the conversation before we say so long?
Well, again, thank you for having me on. Appreciate the thoughts and certainly the effort to go shopping. We hope that all of your listeners and watchers will take that sentiment to heart and maybe consider going out and buying a gift card if they can do that right now to try and help folks out in the meantime, but also not being afraid to go out and shop once we're able to do so.
I can't wait for the day, Amy. Let's you and I go shopping as soon as the day is clear ahead of us, all right?
Looking forward to that.
All right, Amy Drumm joining us from the Michigan Retailers Association. They just having a tough time, Tyler. What are you going to say? None of us saw this coming. And then all of a sudden, boom, it's like a light switch. You got to shut down your business. You're, trying to keep your employees together and try to keep your business together. And it isn't easy. And, and our elected officials, a lot of them, their number one focus is on making sure that the number of deaths go down and we flatten the curve. But Amy's voice and the voice of other people from the business community, really important too.
They are, and it's a tough time for businesses of all sizes, from big businesses that are regional and national that are struggling because they're not staying open across the board, and especially for those small businesses, those mom and pop shop retailers that their business is their livelihood and their business is their employees' livelihood. And so getting them back in a way that's safe and doesn't put their business by putting their employees at risk, but also putting them back in business so they can make some money is going to be vital.
Absolutely. Also vital is making sure that we are handling all the employment-related issues through this whole crisis appropriately. And it gets complex, from unemployment to should your employees be coming to work? Should they be staying home? What happens when employees are at home? I can think of a million reasons why I want to talk to this guy right now. My friend James Reed, attorney James Reed, is joining us here on the Megacast and our radio and TV outlets all across Oakland County. James, counselor, thank you for joining us on the Megacast.
Be here, and I'm looking forward to our conversation. A lot to talk about.
Well, there is a ton to talk about. Let's just start with something that Amy Drumm brought up just a moment ago from the Michigan Retailers Association. And, let's talk about employees during this crisis where they may not want to come back to work. Their employer might want them to come back. The employee may not want to come back, and that can get a little complicated. So what do? You're an employer. You want your employees to come back, and they say, well, I don't think I can. What do you do?
I get that question daily, and I think what you need to do is evaluate if the employee has a disability or some need for a reasonable accommodation versus just they prefer to be more safe at home. And if the employer is providing safe working conditions and offers the ability to space people out more than 6 feet and stay sanitary, there typically is not a good reason to refuse suitable work. And if the employee refuses suitable work that doesn't expose them to imminent death or severe bodily harm, that would disqualify that employee from unemployment insurance. So unless that employee has a doctor's note that says, their doctor recommends or requires them to stay at home, I would engage in the interactive process and work out some way where that employee could be more spaced out and isolated enough where they feel comfortable coming to work, assuming that remote work is not viable.
Yeah, well, James Reed, attorney James Reed, joining us on the Megacast. I get it, though. I do. I get it. We've been, I know you've been watching TV along with the rest of us. You watch day after day after day of this, and it gets awful darn scary. You've been home for the last month and a half, and you've been working at home, and that's kind of cool. You kind of, there's upsides and downsides to it. And now your boss says, okay, we're in phase 1. Our business is opening back up. We're following the rules, so you're going to have to wear a mask, and you're going to have to come to work. And some employees are going, man, I don't know. This just doesn't sound healthy for me. So it's going to be complex. It is going to be complex.
It's a challenge because the PPP loans, require you to use those funds within 8 weeks. And if you can't bring the employees back, you won't be able to pay them out of that loan, and we'll have to return the loan or pay interest on it.
It's going to get crazy. And then we're just talking about retailers. If the governor's going to speak today at 3 o'clock, I don't think she's going to open up the entire state of Michigan today at 3 o'clock. I think that's a pretty safe assessment of what she'll be talking about today. So if you're a retailer, for example, then you can't open your doors, and you got the PPP, Paycheck Protection Program loan. I guess what do? You have your employees work at home? This is why we need lawyers like you to help us figure this out. This gets into so many complicated areas, James.
It really does. I think that now more than ever, employers never really had a remote work agreement, or they never thought they could accommodate employees by letting them work at home. So employers are going to have to, be progressive and be able to change their usual habits and routine. And I agree, even if the governor fully lifted all restrictions, which I'm not anticipating, employees would not immediately come back to work. And this is going to have permanent, forever changes. I think remote work will become more of the norm for positions that allow for it.
Well, and a lot of us have found over the past couple of weeks that we can do our job at home. And you know what? It may be we're saving money, and there's all kinds. We are going to come out of this with a new normal. and there are some upsides to working at home. Are you thinking about, and would you be likely advising your clients that if they do have employees that are working at home, they set up a whole another part of their employee manual and rules to make sure that they're appropriately managing that work at home?
I really am. I think employers have to go beyond that and think, are they going to reimburse the employee for, providing that internet, providing their own equipment, or is the employer supplying that equipment so employees don't accidentally have a virus or have a shared computer where kids or a spouse is, potentially seeing information they shouldn't see, or an email inadvertently gets sent to the wrong people. So I think this is a whole new area where policies need to be drafted and economics have to be figured out of how to reimburse employees for their costs.
You make a good point. You're looking at it from the employee side, not from the employer side for a minute. You're an employee and you're working out of your home. You're saving the company a lot of money in rent and other expenses and utilities and maybe your internet. Maybe you should get reimbursed for that.
I'm seeing a lot of polls done in the HR world. I volunteer as the director-elect of the Michigan Society of Human Resource Management. And there's a lot of talk about how to reimburse our employees for the cost of working at home.
Well, it's going to be a new normal, and we're going to get through this. We've got some tough days ahead of us, but I'm sure all this will get sorted out. James Reed, Attorney James Reed, joining us today here on the Megacast. And James, what about unemployment? Anything you can help both employers and employees? On the employee side, first of all, we just saw a report things are getting better with the state and their computer systems, but I imagine there's still a lot of people out there that have not been able to get on the computer system and file for the unemployment that they so need so bad.
Yeah, I've also heard things are getting better. This is the first time that I recall where independent contractors and self-employed individuals can qualify for unemployment. And there are certain days of the week where, based on your last name, where it falls within the initials, you have a reserved window for you to apply. And I'm seeing pretty fast turnaround where you can get the state payment of up to $362 a week, plus the additional federal payment of an extra $600. So that's $962 a week, which is $24 an hour. This should be in place from now through July 31st. And they actually extended the state unemployment for the remainder of the year for reasons related to COVID-19.
So, I mean, the math that you just did made it very clear there's some people that aren't making $24 an hour going to work. And now they can make $24 an hour staying at home. So, what's an employee to do that? The employer calls them up, says, hey, it's time to get back to work. And the employee said, well, you know what? I kind of like being unemployed. How does that one sort itself out?
That's the major challenge. I'm seeing almost employers offering a perk, allowing the higher level people or the more people with more seniority be laid off first so that they can get the $24 an hour. And the only real incentive you have to motivate that worker is to say, Michigan allows a work share program or an underemployment program. So if you're earning under 1.5 times the 362, so under $543 a week, you might be able to get partial pay from your job, plus you can get underemployment UI payment, which will be some portion of the 362 plus the extra $600. So that way you could have the best of both worlds and tell the employee that the perk ends July 31st. So I assume you want to have a longer career than just between now and July.
James Reed is joining us. He is an HR expert. He is an attorney and joins us here on the show. And James, what else should employers, not to get too technical and deep in the weeds here, but what other options do employers have right now? You can lay people off, you can fire them. Hopefully you're not doing that. I mean, what are the options that are in front of employers? And is there any one that's better, or is it different from situation to situation?
So the big decision is, do you do a furlough versus a layoff? And a furlough typically means that it's a temporary layoff where you're likely going to continue their health insurance. Where a layoff is, there's no guarantee of that person ever being called back. And the balance of what you should or shouldn't do really depends on how likely is it you're going to want the employee to come back. Now is the time where employers are evaluating who are the essential workers and who is necessary to get the job done. And I have a feeling that many companies are using this opportunity similar to what happened in 2008 and terminating their lower performers and cleaning shop, cleaning house now that the budget is tighter than ever.
Well, you mentioned that, and believe me, I'm sure that's going on. And, with every challenge, there's an opportunity, maybe for companies and for employees out there, as crazy as this sounds, this might be an interesting job market out there right now as people are shuffling the deck and looking at it. Certainly senior managers have time right now on their hands, and they might be thinking, well, you know what, that guy works for my competitor. I've always wanted to have an opportunity to talk to him or her. Maybe now's the time. So, in a crazy way, maybe this is a good time to be job hunting.
There are great opportunities, and there's a lot of various strategies. There is not a one-size-fits-all strategy. Some employers are cutting pay for the executives. Other employers are cutting pay for the lower-level workers. And I guess the strategy is, do you want to run leaner and keep as many employees as possible, or do you want to downsize or right-size and be strong when the economy recovers?
If you're an hourly employee and your employer, let's say, cuts your hours back, is that okay? Can an employer do that? And what about from an employee standpoint?
So an employer can do that as long as it's not retroactive. So any pay before you do the work going forward, and certain states require to give, one paycheck advance notice. But once you give that notice, as long as they're receiving at least minimum wage for that state, that is a legal thing to do. If you're doing with an exempt worker who's paid a salary, you want to make sure also that you're giving advance notice and only applying it in the following week. Because if an exempt worker works any portion of a week, they should typically be entitled to their full salary.
Yeah, James, and on top of all the other things you have on your desk, and I appreciate you taking some time for us. You mentioned you're with SHRM, and you folks have one of the largest events anyone holds in the state of Michigan. You've got over 1,000 people coming to Grand Rapids this fall for a convention, and we work together on that project. I might as well just say, in the interest of full disclosure, and it's a tough time for people planning events right now. Do you have any thoughts on, and any advice you can give to other folks that are going through the same thing?
Yeah, I have a feeling we're going to be working closer than ever. I think a lot of companies are doing remote conferences. And as you mentioned, we have to have a backup plan of if certain sessions have to be remote to make sure people are spaced out sufficiently where we're not, getting too close if coronavirus is likely still around in October. And we need to be, proactive and maybe cancel the conference entirely and make it
that can't happen. No, we'll talk about. There's all kinds of cool things that people are doing. I've seen virtual conferences and all kind. People are going to do what they can to get through this. We will get through this one way or another. We will get through this.
Yeah, I think the most important thing is to just have fun. Like, I'm seeing a lot of good managers checking in more than ever. Today is 4/20, which is the California Police Code for marijuana.
is that what see? I didn't even know that. We were interviewing the wrong people today, Tyler. I didn't realize that was today. Go ahead, carry on. I'm sorry, James.
So I guess the concept is now with marijuana being recreational in Michigan, are we going to allow or change our policies to allow employees to drink on the weekends, have recreational marijuana, or are we going to restrict it? Do we have any policy on it? And with people working at home, how are we able to monitor or drug test, any potential workers as well?
You did bring it up. So, I was going to run along, but it is an interesting issue. Do we need to have, because it's legal, right? It's legal to smoke marijuana, and as long as you're not driving a truck or doing something dangerous and you're doing it on your own time, can an employer tell their employees that they cannot smoke marijuana or drink alcohol during their off hours?
So actually you can. There's two reasons why. One is marijuana is still illegal under federal law. So for example, it would never be a reasonable accommodation to a disability to allow someone to have marijuana because it's illegal under federal law. And the Michigan Marijuana Act does not provide any private employment rights. So marijuana users are not a protected class. So if you wanted to discriminate on that basis, there are no laws in place that would prohibit it in the private employment context.
All right. Well, we're going to get through all this. James Reed, thank you very much for being with us. Good to talk to you. And if somebody wants to get a hold of you, maybe they're looking for a really good lawyer that specializes in HR issues, how would they do that?
My cell phone, 734-649-1313, or email james.reid@dinsmore.com, dinsmore.com.
James, thanks for being with us. I appreciate it. Good to talk to you.
Hey, anytime. We'll be in touch.
All right, James Reed. I forgot 420. I didn't even realize that today was the day.
Yeah, it is.
Of course, we behave ourselves 24/7, so why would we even know that today is 420 day? I'm going to give out James' number one more time because his Zoom clipped out there for a second. 734-649-1313. James.Reed@Dinsmore, DINSMORE.com. And we thank him for joining us. We're going to take a break. We'll be right back. This is the Megacast on 89.3 Lakes FM, lakesfm.com. We are on 88.1 WBFH The Biff, WAHS 89.5 Avondale Community Radio, and Civic Center TV, and we'll be right back.
Hi, I'm Dr. Jonay Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
Hi, I'm Oakland County Executive Dave Coulter. Our top priority remains slowing the spread of COVID-19 in our communities. Please stay home, and when you must go out to an essential business, take precautions like social distancing and washing your hands when you come home. Because of the pandemic, we are behind in our response rate in Michigan. While you are home, please take a few minutes to fill out the census. It is more important than ever that we receive money back from our federal government. The census is Oakland Together.
Thank you, David Coulter. In fact, County Executive Coulter will be joining us, I think, on Thursday, certainly later on in the week. One other thing, as long as we had him there, to mention that if you want to get an update from the County Executive's office, Tyler, I think they are doing a 1:30 Facebook Live almost every day. So if you go to the County Executive's Facebook page, I think that's there. So just another way to keep up to date on what's going on in the county. Big news headlines today here on the Megacast with regard to the coronavirus crisis here in Oakland County and in Michigan. I can't get any words out today. Asymptomatic testing is now available for first responders in Oakland County. For the rest of us, we also can get tested, and all we got to do is make a phone call. I know we have the number here. Here it is. All you got to do if you want to get tested in Oakland County, there's now testing at the Oakland
County. Both 800 numbers.
Yes, at the Oakland County offices. And the number to call, you got to call the nurse hotline and look at your schedule, is 800-848-5533. 800-848-5533. Add that to the testing that's going on at Henry Ford West Bloomfield and the testing that's going on over at St. Joe Hospital. And there seems to be a little bit more testing going on in our area. That is good news. The numbers continue to improve a little bit. We'll get more information from the governor. She's got a press conference this afternoon at 3 o'clock, and we'll hear what her plans are after a lot of appearances all weekend long on all the national television programs. She heard from the president late last week, three-step program from the president being passed down to governors. Now governors like Gretchen Whitmer and others around the country are deciding how to implement that. What happens in Michigan is in her hands. The Michigan legislature has been very busy saying they want to see some things happen right around May 1st. So a lot of back and forth, a lot going on. Critical presser, as we called it in the biz, media conference today at 3 o'clock with the governor. Will be interesting to hear what she has to say. Unemployment filings in the state of Michigan now over a million people, and those numbers continue to grow. So our hearts and wishes are with you if you are suffering through this crisis, whether it be just dealing with the coronavirus itself, dealing with unemployment and some of those issues here in the state of Michigan, or maybe even just a case of cabin fever. Our thoughts are with you, and we thank you very much for joining us here in the program each and every day for an update. Joining us now is Dr. Ronald Lederman. He is an orthopedic surgeon and sports medicine doctor. And Dr. Lederman, let me hit a button or two here. I think there we go. We got you up on Zoom. You're looking good, doctor.
How are you?
I'm great. So I always ask everybody, because everyone's been checking in from their homes, how's it going? Are you at home? Are you at work? Where are you? And I can see your scene there. How are you doing and how you feeling?
Yes to both. And actually, when this whole thing started and we saw the number of patients drop about 90%, we went to half days to stay open for the urgent orthopedic cases and people that were in so much pain that they needed our help, whether it be through injections or localized limited therapy and the likes. But we took extreme precautions when we did that. Of course, this was over a month ago. I think we were the first ones in our medical center, at the Lakes Medical Center in West Bloomfield. We actually set up a table out in the lobby of the building before anybody came into our actual office space, with taking temperatures and questionnaires and making sure everybody was properly protected. And so we have been seeing patients on a limited basis, but taking extreme precautions. And the other important thing is we're sterilizing the office with hospital grade material before and after every patient. So patients have felt very safe coming in, but we have also made sure that we get the message to everyone that stay home if you need to, if you can. And we also transitioned to telemedicine, which a lot of my colleagues, at least non-surgical colleagues, are doing.
Yeah, no, in fact, I was in your building not too long ago. There's a pediatrician in your building that we talked to. And you know, they're saying the same thing, that call, please pick up the phone and call before you come in for any medical care. Just don't show up at your physician's office. Call. And a lot of folks, we've been hearing over the past several weeks, there's a lot of telemedicine going on. However, if you've been treating somebody and, you know, their treatment cycle comes up, you know, they're going to be in severe pain and a lot of difficulty if they can't get that treatment. So you've been able to, it sounds like you've been able to continue that therapy for those patients.
Well, we have, but very limited. I mean, we might see 100 physical therapy patients in a day, and now, you know, it's probably 10 to 20 patients. And as painful as that may be, from a revenue standpoint, you know, you always talk about trying to generate enough revenue to keep the lights on, to keep the doors open so you can treat people that need you. What's good about that is 1 or 2 patients will have the entire physical therapy department. You're spread out. We're not 6 feet apart. We're 30, 40 feet apart. But yes, the short answer is we have maintained a lifeline to the community for people that need us. And if they have to come in, we are taking extreme precautions to make sure they're safe, to make sure our staff is safe, and that the community at large is safe. And if someone can't come in or doesn't want to come in, or we don't feel it's safe for them to come in, then all of our doctors, me, Dr. Portowitz, Dr. O'Keefe, Dr. Hyman, all of the providers, even our physical therapists are providing telemedicine. And my wife's best friend actually hurt her shoulder. She's been doing what everybody should be doing, and that's staying at home for the most part. And she actually did an online telemedicine evaluation with my director of physical therapy, Jenny Simmons, and she called me later that night and said it was amazing. So you think, how can a video conference or on the phone help someone with the physical therapy, which is very often hands-on, but it can. And it'll be interesting to see how this changes things moving forward.
Well, I never thought I'd be sitting in here doing a radio show with all of my guests on Zoom and then on TV as well. So now it's a new normal. It's a new world. We're going to, yes, some good will come out of this with people working at home in a safe way and more telemedicine. I'm sure some of it, but I'm sure you'll also be happy and your patients will be happy when it's easy to come back into the office and get together as we have in the past. So,
I think
go ahead. I'm
very
sorry.
happy.
Yeah,
I'm sorry, but I was going to say, I agree with the quarantine, the lockdown. We obviously have to be very safe. One thing that didn't make a lot of sense to me is closing down the surgery centers to do not elective, but even urgent cases. I mean, if you step off your front porch and you break your ankle and it requires a 1-hour surgery to fix it and get the bones back in place, then you can go home. It always made sense to me, do it at a place that doesn't have COVID-19 patients being treated. But we've been forced to take patients to the hospital, and the hospitals that we work at, the Beaumont Botsfords, the Ascension Providence, the Huron Valley, everybody has taken very good precautions to keep people safe, thank goodness.
So, Dr. Lederman, thank you for the update. So I'm curious because I read as many of the rulings as I could, and I didn't see all the details for physicians. So right now, if you do, let's say you break your leg, and you the only way you can get a treatment, and maybe you always would go to the hospital, I don't know, but the only way you can get any orthopedic treatment, we'll leave it general, is to go to a hospital for a broken bone of some kind? Is that what you're saying?
Well, it depends what kind of break it is. But no, I'm saying that's the only place, if you need surgery, that you can do it right now, because the governor has shut down all the surgery centers, the freestanding ambulatory surgery centers, which have become busier than ever before COVID-19 because there's been a shift. Even insurance companies are shifting surgeries, smaller surgeries, elective surgeries from the hospital to a freestanding ambulatory surgery center because you can deliver that care for a lower cost. You're not amongst sick people, so there's less of a risk of catching an infection while you're there having your treatment. And it just made sense that we should be able to continue to do that. But that hasn't been the case. And like you said, it's a new norm and everybody's adjusting, and that's fine. We're hoping we can get the surgery centers opened up next month, within the next 2 weeks. So all of those people that have had meniscus tears in their knees and have pain walking can get their 15-minute arthroscopic surgery done. For the people with rotator cuff tears that are having tremendous pain and can't sleep at night, we can start fixing those. For the ankle, elbow, wrist carpal tunnel problems, we can start getting people better. But you're right, you mentioned earlier, right now people are staying home, and at some point they're going to want to come in and get seen. Even though they can come now, you want to take great precautions doing so. But when everybody's allowed to go to the doctor, it'll be interesting to see if the floodgates open and what that looks like.
Dr. Lederman, is part of the reason these surgical centers have been closed down because we need respirators and other equipment for the other centers, or were there other reasons why these other surgical centers were closed down?
That was definitely some of the initial reasons. But the anesthesia machinery and equipment we have is typically not what's used in the ICUs when someone's on a ventilator. So, what people do, and it's human nature, and especially with something as serious as COVID-19, is you take extreme precautions in the beginning, and I think they have, and obviously we're seeing the benefit of that with, everyone I've talked to. One of the best emergency room doctors I know, Dr. Sandy Veeder out of Beaumont Botsford. He's been the head of the ER there forever. We're hearing that things are really slowing down, thank goodness. Moving forward, that's going to be the trick. How do we open up? Everybody's heard about this on the news every day, all day long. And it's true. We need data. We need a way to test people accurately. I envision that people are going to have a card saying that they tested negative and use it the way they use their driver's license to get in the car and be able to drive. They're going to need it to get into the restaurants when they start opening up, or maybe even to go to the doctor's office. Now, doctors' offices have the ability to screen people better than most, but it's going to be very interesting. So the short answer again is we have not had to give, which we were more than willing to do, any of our equipment or even some of the lower level PPE that we use at a surgery center to the hospitals because they did manage here to have enough. And
what do you advise folks doing? So if someone is listening or watching right now and they have some kind of pain, their knee, their elbow, their shoulder, something is hurting them, something you would see an orthopedic surgeon for or a sports medicine doctor, you pick up the phone and call. Is that the first thing to do?
Yes. Well, for anybody that's in pain, we're there and we're able to see them. And we spread out all of our providers. So you can go to our website, which is LK Orthopedics, ORTHOPEDICS.com. You can actually make an online appointment. Or you can call our office, 248-669-2000. And again, on the phone, there would be some screening. But if you're young, if you're healthy, if you haven't been exposed to anyone, if you come to the office, you will be screened. You'll have a temperature taken before you get into the office space. And you'll see the precautions we're taking. And even 85-year-olds who we have said, stay home and wait, they've been in too much pain. They've come in and they've all said that the precautions you're taking have made me feel so safe, which really warms my heart because this is a stressful time for everyone.
It is.
And if we do our part in bringing that down for people, then that's important, along with helping people with their pain.
So, Dr. Lederman, thank you for joining us. It sounds to me like your message for the governor for this afternoon at 3 o'clock and the days coming is let's get some of these surgical centers open again as soon as possible so we can get back to treating folks. And you're saying that now we've got the vents out there in the community. You're saying that we can do this in a healthy way and get some of these surgical centers back open again, and that's what you're sharing with us today. Did I get that right?
Yeah, absolutely. And if we can have our governor and people in the White House, stop the partisan headbanging, I'm certain that she would be on track with that as well. But that would be the message. Let's be able to start helping people. Let's do it smart, and let's do it in a safe way.
All right, Doctor. Well, hey, listen, everyone's advice is good. Everyone's opinion is good, and we're just going to have to count on that knuckle-to-knuckle thing you were talking about there a minute ago. Hopefully that won't be happening too much. But all we can do here in our show is just, let folks like you share your stories and share your expertise, and hopefully it will be heard and it'll make it better. Thank you so much for taking some time. Can we keep in touch? And let me know what's going on, because a lot of the issues I didn't really think about that you brought up today. I wasn't thinking about the surgical centers. For me, I want to go, into some bar and have a pizza. That's what I'm thinking about. Not getting my sore knee taken care of. Although I got to work on that. But so it's a whole other aspect of this thing I wasn't thinking about. So I really appreciate it.
Well, I appreciate you having me, and I'll be available to come on whenever you need any updates or help. Unfortunately, I've got more time than usual, but I think this is helpful, and I'd love to come back whenever you need.
Dr. Lederman, thank you very much for joining us. Dr. Ronald Lederman, orthopedic surgeon, right here on the Megacast. Tyler, I wasn't even thinking about the surgical centers.
Yeah, neither was I. It's an interesting point that he made about how that's impacting these not necessarily non-elective, but critical surgeries that people need to, because they're in pain or they're very severely injured and they need to get surgery, and how that's being impacted by this as well, because that's something that a lot of people probably aren't thinking about.
It goes to the point too, and I'm not here to pick on or protect the governor or take the Trump side or the Whitmer side. That's not what I do. But I don't care what side you're on this. If you're picking a side, this is complex.
It is.
This is very complex, and I really think, and I've been saying this for a week or so, that untangling this thing is going to be somewhat complicated. It's going to be hard to keep everybody happy, and emotions are getting a little bit higher too, because we all got cabin fever. We want to get out. The weather's getting nice, and trying to figure out all these different things, and then everyone is impacted economically. A lot of us are impacted emotionally, almost everyone. And so many of us have been impacted with the loss of life of someone that is near and dear to us. And it's a very complex situation that we need. And now we need our elected folks to be their absolute best. So we hope that's the case. Hey, we're going to take a quick break. We'll be back in just a moment. This is the Megacast. I'm Dave Scott. He's Tyler Keefe, and we'll be back in a moment.
The Centers for Disease Control in Oakland County Health Division encourages households to prepare for the possibility of a coronavirus outbreak in their community. Keep extra items in your house for an extended stay at home. Remember any special food items for babies, the elderly, and pets. Keep non-prescription drugs and other health supplies on hand, such as personal medications, at least 1 month's supply, first aid kits, alcohol-based hand sanitizer, at least 60% alcohol, non-mercury thermometer, and get copies and maintain electronic versions of health records. Talk with family members about how they would be cared for if they got sick and what would be needed to care for them in your home. Learn about the plan at your child's school and your workplace. Discuss sick leave policies and/or telework options for workers who become ill. For more information, go to oakgov.com/health or call our Nurse on Call hotline at 1-800-848-5533.
All right, welcome back to the Megacast. Dave Scott, Tyler Keefe over there, 6 feet away on the other side of the studio. We thank you very much for joining us on our great radio stations, 89.3 Lakes FM in the West Bloomfield area, 88.1 WBFH in the Bloomfield area, and WAHS 89.5 Avondale Community Radio across from Macomb and a bunch of Oakland County. She is a dog trainer with Good Choices Dog Training and Services. Tyler, this coronavirus impacts every sector of our community, including the dog and cat world. Elaine Chan is on the line with us. Did I pronounce your name right, Elaine?
Elaine Chan.
Chan. Elaine Chan is with us. And so what's going on? You're with Good Choices Dog Training Services. How is this whole coronavirus fiasco impacting your world?
Well, it definitely impacts a lot because we have a lot of fun events just leading up right up to the stay-at-home order was instructed. And one of the big events that we had was the Corgi Fest. And we had a lot of corgi was ready to come to the fun event. We have over 40 people actually were planning to come, and that has to be canceled due to the whole virus situation. So a bunch of people were disappointed. And then on the training aspect of it, a lot of things has to be canceled and postponed. And I had one class, I had a bunch of puppies. I watched them grow up, and they were ready to move on to the next level. And it was just kind of sad that they weren't able to continue the training. And sometimes it makes it hard because the puppy really needs help. They got to learn how to, learn their manners and stuff. So that having to be able to have to postpone everything definitely make it more difficult.
Elaine Chan is a dog trainer with Good Choices Dog Training. Elaine, unfortunately, we're tight in time today. But so what can if you got a new puppy at home? Okay, a lot of people maybe got a pet recently because they really want a companion in their house during these days. If you have a new puppy at home, what are some things that you can do to help that new puppy be a little bit better around the house?
I think the first thing is that now that if you're at home, one of the things that you want to work on is definitely potty training, because potty training is one of the big things that when you get a puppy, you got to get it right. And a lot of times the struggle is that people often are not home enough so that they can really make a schedule to train a puppy on the pottying. So I think if you are home now, there's really no excuse to saying like, hey, I can't let my dog out on a specific schedule. I think the potty training will be the first thing to work on. And then second thing is to get them used to learning how to go into a crate. And because the whole thing, they have to learn to be separated from their owner, just in case, when things go back to normal, they have to learn that they can be isolated. So I will practice having the dog stay in the crate, having the owner go to a different room, so then they learn to be separated, so they're not completely, constantly be with their owner.
I know, but Elaine, it's just like having a little kid. The dog is barking and the kids are crying and they're in the other room, and then you start feeling, oh, the poor puppy. But they do. It's good to hear you say it. They do need to. It's okay to put them in a little crate or a cage, and they do need to be isolated. It's good for them, right?
Yeah, and then the other things that they can learn would be teaching them through games, playing with them, teaching them through games like playing tug of war, playing nose work games, playing games that can kind of get the training ideas sort of on board, teaching them to do handling exercises, get them used to being handled by different family members in the house, get them used to being ready for grooming and things like that, because that's, also kind of gel into the socialization topic as well. And I think the big struggle and the big worry is that the puppy that are now being purchased at this time, the socialization is going to be a little bit hard. But when you think about it, socialization is just to help the dog to get used to everyday environment in a sense, and then teaching them to be more comfortable and to be more confident with the everyday environment. So there's a lot of things that you can do in the house right now, even though that you can't be outside meeting other dogs or meeting other puppies or meeting other people. They can do it in the house too. Things like soundtrack, they can get used to different types of sounds, get them used to household items. People can dress up so that they can look different or act different. Like family member can role play to get the puppy used to different people moving and things like that. Carrying things, looking different, or getting them used to like things like umbrella, rolling luggage, things that can make sounds and noises in the house. And those are good things to start out right now.
Elaine, you're telling me our dogs are that observant, so if we wear something different or act a little bit different, they're going to get that. So I got a friend whose dog, this is so funny. I got a friend whose dog, anytime another dog is on TV, the dog starts barking at the TV. Is that common?
Oh, yeah. I have one at home just like that. Yep.
So maybe it's actually, I got to go, but maybe actually if you're going to get a pet, maybe now's the best time to do it because you're home a lot. You're going to have a lot of time, and you can really socialize with your dog. Real quickly before we go, I assume getting professional training is always a good idea.
Oh, yeah, definitely.
All right. Do you want to tell people about how they can get a hold of you and your business?
I have a Facebook page at Good Choices Dog. That's the Facebook page name. And then I also, you can contact me by phone number. You can also email me. And you can also find me at Premier Pet Supplies. I have my cards and flyers there as well. And also the local pet store like Pet Value also has my information there as well. And I also work with the West Bloomfield Parks and Recreation with their program. So if you're in West Bloomfield, you will definitely get to know me.
All right. Well, we'll look forward to seeing you around the community. So if Premier Pet Supplies is an essential business because they have food. Can you actually get a dog right now if you wanted to get a dog, or is it impossible with the coronavirus
there
case?
There are definitely puppies out there ready to go home. I mean, people, people plan on getting a puppy, but they didn't plan on a pandemic, right? So I do know there are actually several friends of mine that are in the dog world have gotten puppies. So, the things don't, that aspect doesn't stop. That's for sure.
Elaine, we got to go. Who's your friend back there behind you?
Oh, that's my dog.
Who's your dog?
Yeah, that's Mumu.
Let's say hi real quick. Then we'll scoot along. Of course.
She's ready to do some tricks.
Well, can we have you and Moo back another day because we're out of time and I ran a little late. I apologize.
Yeah, that's fine.
But
that's no problem.
Tell us about Moo. What kind of dog is Moo and how old is Moo?
She is a Quaker Hunter. It's a really rare breed. There's not that many in Michigan, and she is 6 years old. She just turned 6, and I dance with her.
All right. Well, can we have you back on in a couple of days? And I'm sorry we ran a little long.
Let me show some tricks.
All right. Bye, Moo. Thank you for coming on, Elaine. Thank you very much. Thanks, Elaine, for coming on. I appreciate it. What a great way to end the show today, huh, Tyler? It was a lot of fun.
It was, yeah. Nice to see Moo again. I was out on a story a little while ago for our news magazine locally, and got to interact with him. Very nice dog.
All right. So more testing. Clearly, on the front line, look, this show, we find out what's going on. And I think we can say today, after talking to the experts and the first-hand news accounts, we're seeing more testing here in our area. St. Joe Hospital, say they're testing. Oakland County, they are testing. And that number to call again if you want to get scheduled for a test is 800-848-5533, 800-848-5533. Governor's press conference this afternoon at 3 o'clock. It's going to be a biggie today. I think, after she was exposed so much via the media the last week or so with the protests here in Michigan and other stuff going on and being on so many national programs, Michigan is really, right in the epicenter of this whole thing. I think it's going to be a big day to see what she has to say today, and hopefully some indication of what the next steps are, some clarity on what the next steps are for Michigan.
I would agree. I think today's press conference sets the tone for where we go from here and what we can expect from the Michigan state government as far as the potential for reopening Michigan and what that timetable might be.
And certainly a lot of opinion on all sides. We heard from the Michigan retailers. They can't wait. We heard from an osteopathic doctor. He would like to see the surgical centers open up. We hear from people all over the state of Michigan ready to get this thing open again. And at the same time today, we heard very, very helpful commentary from Dr. Russell Faust, the medical director at Oakland County Health Department, saying we got to do this the right way. We got to do it the right way. And still plenty to be concerned about. And at the end of the day, it's all about washing your hands, Tyler. It's all about washing your hands and keeping things clean and wearing the masks when you're out in the community. Because, they can't open this up if we don't do our part. So do your part. Make it a great day. We'll see you again tomorrow right here on the Megacast. Thank you very much for tuning in. I'm Dave Scott. Tyler's got to go hit a couple of buttons, and he can't be there if I'm over here. And we thank you very much for joining us. We will see you tomorrow on 89.3 Lakes FM, WBFH, and WAHS, and, of course, on Civic Center TV. Thank you very much for tuning in to the Megacast on all of our radio and television outlets, and have a great day.